So let's move for the second part about how to deal with home isolating patients, which indeed we have like 6 points I want to address here. The first point, like loneliness and isolation, to keep patients, some of them for even 1 month, to be home isolated. And because of the lockdown, they were previously, even before they get infection, for a long time home. They were just leaving for a short time. So all this complicated problem of being home, indeed, it is a huge topic, but we will compromise it in a short time. So which message should I convey to the patient? What should I tell them to bring them out of suffer from this loneliness and home isolating?
Yeah, I think it's a very common problem, and I think a very understandable one. One of the core needs of any human is to have that connection with people, and when you take that connection away, then that their core need is not being met. Yeah. So I guess what we have to try and support people with in these circumstances is thinking outside of the box. How can we still meet the need, but in a new way? Because the current regulation doesn't allow me to have that physical interaction. But because I'm not having the physical interaction, doesn't necessarily mean that I can't have any interaction. Yeah. So increasingly, and again, thanks to this technology, we have the opportunity to use a number of platforms. We've got the WhatsApp, Telegram, we've got the telephone, we've got other social media, Facebook, Instagram, whatever it is that helps us to maintain some connection. Now, of course, it's never going to be the same, but it's going to be better than not using it at all. So even within that, I think there's focusing on the type of conversations that you do have. Now, I've had some experience where, because my parents also, they have some underlying health conditions, which makes them vulnerable. So they shouldn't be going out. So when I do call them, when I try to have some contact with them, all the questions is, oh, have you seen in the news, there's even more people are getting, infection with COVID. And, they're making some delays with the vaccine. And, the economy is going down. And all the conversation is just negative. So I think that's also an important area in terms of that connection that we need to be aware of, particularly when the only opportunity for interaction when people are isolated and lonely is being taken up by this negativity. Now, not everyone has access to the technology. This is my assumption. How many people would you say in Iraq don't have a phone? What percentage?
I would say 30% maybe they don't. Some of them, they don't have phones. Some of them, they don't have internet. So
right. So then I guess we're limited in terms of using social media, and we may also be limited in being able to use telephone calls. And I'm wondering, what other means of communication are there if you're not using telephone or social media?
Well, for my patients, some of them I advise when they have, for example, garden or like in the seal or an open space, they can sit together with like 2-3 meters like distance, fruits, tea time, like especially like afternoon, close to Maghrib, or even at night when the weather like calm down, temperature is okay, safe place when it's open air and safe distance. Then also to do it every day, it's very important, I find it.
Right, absolutely. So there can be some way around, and even though we might not be able to keep in contact with those that are normally most important to us, maybe because of distance, not everyone can come and sit in our garden or in our local space. That gives us opportunity to nurture new relationships. I guess coming back to the main point, that human need for connection. Now, this may be a little bit more abstract, but when you can't talk to people all the time, who else can you communicate with?
Allah, yeah. Dua, pray, yeah.
Absolutely. So our faith can really play an important role here, and I think these challenging times can sometimes present opportunities that otherwise everyday life wouldn't allow us to have. And I have to say, even I'm 40 plus, but in all my years, I've never taken the time to talk to my Lord in the same way as I have during lockdown. I just have that extra time, and there's less people for me to speak to. So now I'm able to try and open my heart to my Lord. And once you start that habit, you see that it grows, because you can feel a response. But it helps us break out of this limit of, there's only my everyday interactions for me to focus on. So these are some of the things that can help in the isolation and loneliness.
Yeah. So the second part, maybe also to cover it in at least in compromised like time, despair and hopelessness. So I think we have many patients like all they ask, will I survive? Will I go over this? Will everything okay? Yeah.
Yeah, no, absolutely. This is an important area, and when it's difficult for us to give a clear prognosis, then our ability to give them some clear assurance about their survival prospects, their recovery, is going to be limited. So I guess from a medical standpoint, there may be limitations on the information we can give. We try our best with the information that we have. Psychologically, what other areas can we draw on that might help to counter some of the hopelessness? And I'm going to go back to what I started discussing in our first discussion, which is what you focus on grows. Now, if you focus on, I will never get better, things will never improve, my condition will only get worse, then of course that is what's going to occupy your mind, that's going to dominate your feeling. And I guess one of the risks here is that hopelessness at the extreme end can lead to suicidal ideation. Yeah. So it is important when we recognize that to try and take some steps, some intervention. Now, hopelessness in terms of time frame, it's not looking at the past, it's not looking at the present, it's looking at the future. So when someone mentally is in the future in a very negative place, then the alternative is to bring them back to the present. And again, just going over with them, the future is not in your control. The present is in your control. So to help with that despair and that loneliness, can we engage in some activity that keeps us focused in the present? Yeah, is there something for me to do right now to keep my attention on, rather than keeping my attention on something in the future that I can't control? That may not even be the case. Often tasks that engage the senses can be helpful. So I give you just one example, and this is what some aspects of mindfulness really draw on, is engaging in the current sensory experience. Now, the stronger the stimulus on our five senses, the easier it is to stay in the present. And to some extent is this theory that helps us to understand how sometimes people will even resort to self-harm behaviors because it's such a powerful stimulus. Pain is a very powerful stimulus and can be used as a coping mechanism against another sort of emotional pain. But the person may use a physical pain. Now, we want to try and use this principle, this theory, in a positive light. So one example that I can share is when I'm cooking. So, you know, even just peeling some fruits, yeah, preferably without a knife if there's some risk, you know, involved, some history of self-harm or suicide. But, you know, when I'm looking at the orange, right, you know, it's the color of the orange is something I can focus on in the moment. When I peel it, I can feel the coolness of the skin. I can smell the orange. I can taste the orange. And just being able to take the time to even eat one mouthful in this more mindful way can help to maintain more of a focus on the present. Now, eating is just one example. It can be any of your normal activities that you would do at home in isolation. Yeah. But with the focus on noticing each part of your experience. Yeah. Now, this can work somewhat, but you know, constantly trying to stay in the present isn't always something that people find easy to do. So when it comes to the future and hopelessness also, if I can get you to visualize for a moment that you look in front of you, and maybe if you look out of your window, I don't know, Abdullah, do you have a window near you?
Yeah.
Yeah. If you look out of the window, what do you see? Trees. So when the hopeless person looks into the future, they see the end very quickly. Or they see a negativity right in front of them. Now, what is beyond your tree?
Buildings.
Right. So now what you're trying to do is look beyond the immediate difficulty, beyond the immediate hopelessness.
Mm-hmm.
And I made a short video on this based on the experience of Viktor Frankl, a psychiatrist who wrote a book called Man's Search for Meaning, and you know, created the foundations for logotherapy, which is about building hope, which is about thinking about, well, what do I still have to do? And you know, that may be linked to, for some people, it may be a new question, or maybe a reminder of an answer that they already knew. What is my purpose? What was I here to do? Abdullah, if I were to ask you to fast forward in 1 year's time, is there something you would like to be doing in a year's time that's important to you?
Hosting you another webinar.
Yeah. And maybe just sharing knowledge.
Exactly.
Yeah. So as a research physician, I recognize that knowledge may be very important to you.
Mm.
So if, say, for example, all the world's internet stopped today and you couldn't share knowledge in this format, doesn't mean that this is going to be the case forever. That you could still have hope that, you know, I will reach a broader audience to share knowledge in the future. So, you know, for some people it may be, I still want to, even though right now I can't do all the things for my family that I want, there are things I still want to do.
Yeah.
There are places in this world that I still want to see. You know, there are, I'm a foodie. There are still dishes that I want to taste. Yeah. There's always something beyond the immediate tree, that block, that negativity in front of us. So there's something about being able to stay in the present, but there's also something about being able to look beyond and link that in a meaningful way to our own purpose.
May I share one situation like that I had? One of the families we were following, the problem, they was not taking any medication. They refused to go with the like advices. Then when I checked that they lost the mother, so she died, and I asked to take the father number, so to talk with him. I thought he was really depressed, not willing to do anything. He said, I lost my wife, like life ended her. So I brought another door for him, or opened another door. I said, well, you are the father. Of course, it's hard that you lost your wife, but of course, you love your kids and you want to save them. And saving your kids starts with you saving yourself, because you are the one who bring the hopeness, like feeling willing for do like being cured from this disease, and you are the one who share the energy between them. You are the one who affect them. So just like 6 hours, then he called like, which medication should I take? And alhamdulillah, he cured by now. So like I opened a gate which matched him like as a father. Yeah.
A fantastic example, and you know, just it sounds like you've done a great job in connecting with that father, or connecting that father with his purpose.
Yeah. Yeah.
Of the grief of the loss of someone so important to him.
Yeah. Yeah. So the third part would like to talk about, which also connected with the home isolating, is lack of activations. This may a problem from the like somatic part when my body not being active. Indeed, my immune system decrease. Everything will be limited or inhibited, and also the psychological part. So, how to go with it? How should I deal with patient to solve this problem or face this challenge? Yeah.
Yeah. Thank you. It's a really relevant point. And often an inability to empathize with one of these patients will lead us into just giving them some oversimplistic instruction. Just do more, just do something. But if the person lacks the motivation, if they lack the physical capacity to actually engage in doing more, then you know, following that instruction is not going to be possible, and it undermines the credibility of the clinician. It destroys whatever trust there might be. So first of all, you know, going back to our principles of allowing that person to be heard, to offer some empathy, and to acknowledge that this is really hard, and then to use that as a basis to give them a rationale. Start building their motivation that if we don't do anything, what will continue to happen? Yeah, it's almost looking into the future, that if we keep going in this direction, it is pretty hopeless. So if we want to change the trajectory from going just down and try and maybe build something that's going to get better, what can we do to change it? Now, if I tell that person, do this, this, and this, maybe they'll listen, maybe they'll remember for a week, for a few days, and then that's it. But if it's possible in some way for me to get the answers from them, their ideas, they're more likely to take ownership. Yeah, it may be possible that rather than just for a few days, it might last a few weeks. Yeah, I'm not saying it's going to be a permanent change in them, but maybe it gives them a bit more of a booster because it's coming from them. Now, of course, there is your position of power and expertise that they trust what you're going to say. And sometimes they don't want to say anything because they're like, well, you know everything. You're the expert. You tell me what to do. And if you find that that's the sort of dynamic, then you've got a stronger case to be able to just give them a prescription. So, you know, this is what you need to do. But that prescription needs to be realistic. It needs to take into account how we build up slowly, and it needs to take into account the psychological state of a person when they're attempting to do something that, you know, is maybe part of a routine that you know, many of us will think this is a normal thing to do, but for that person has become really difficult. And that difficulty is compounded by the way they may attack themselves. The story they're telling themselves that I can't do this, I'm no good, I'm useless, I'm a failure. And we can start to manage that by encouraging them to take a more self-compassionate outlook. So if I was to say self-compassionate, what would be the closest term for that in Arabic?
Hard to say now, not in my mind. Self-compassion just not in my mind, like no.
That's fine. And so if there's not an easy word, maybe as you've done, I think very effectively, you know, in our discussion so far, is give a story. Mm-hmm. So let me give you a quick story. So we have a child, and you know, he's playing with his ball and he's running after the ball and he trips over and he hurts his knee, has a cut, is bleeding. What would you do? You've got two options. Option one is you shout at the kid, "You stupid child, look, you're running and you're not looking where you're going, and now look, you've hurt yourself." That's one option.
Yeah.
Another option is, "You know what, that must really hurt. And I can see you were trying your best to run after the ball, and you didn't notice. What do you think we can do next time?" We want to teach them a lesson. We want to protect them. But there's a really critical approach, which actually may not be very helpful for them. And there's a compassionate approach. It's not saying that everything is okay. It's still helping them to learn and improve, but it's with compassion. And then which voice do we speak with when we speak with ourselves? When I'm really struggling to get out of bed, when I just don't have the motivation, when I know I need to wash myself, but I just don't feel like I've got the energy. When I've got a dinner to prepare for my family, or I just need to keep my house clean. These things can feel really hard to do. And as you mentioned, the longer we leave it, the more inactive we are, the harder it is for our immune system to cope. Even our muscles start, not quite atrophying, but they become weaker.
Yeah.
So being able to speak to ourselves in a more compassionate way, to say, you know what, it's okay if I don't start off with cooking a meal for 6 people. Maybe I can just start off by just maybe cooking for one person, 2 people. Maybe I can't even cook. Maybe I can just help. I can be in the kitchen with someone while they're doing it, and then use that to build up my momentum. Maybe at the moment I don't have the energy to do some exercise and walk for half an hour. Maybe today I can just go up the stairs and down the stairs twice.
Yeah.
And using these as baby steps to build that momentum with self-compassion, so that we can become more activated. And within that activation, trying to have a balance of the things that give us some sense of achievement, that we're doing something useful for ourselves and our family, doing something that gives us a sense of connection, so that it's not just in isolation, that we're not just one person in one part of the kitchen, the other person in the other part of the kitchen. There's communication, and there's some sense of pleasure. Because often in times of pressure, the pleasure feels like that's the first thing that should go out. But we're human. There's a part of us that needs nurturing. And that pleasure can come from things that maybe we can just enjoy by ourselves. I'm wondering, Abdullah, is there any example of something you enjoy doing?
Personally, I go with the bike, but even for my patients, some of them, I give them some task training or exercises. Some of them say I can't move. I give them, okay, in bed, just take your hand 5 times wide, then raise your legs 5 times. That's it. Just this every 2 hours, or 3 hours, just to keep it.
And again, I'm going to do a very quick practical exercise with you. And I think that there's Zainab Ali and there's someone on iPhone. So I invite you to participate as well. Is just take your chair back and just stand up for a moment. And I'm only going to ask you to do this for 5-10 seconds. And it's raise your arms up to the side, keep your legs wide open, and then bring your arms down. And now we're just going to do the star jumps 5 times. 1, 2, 3, 4, and 5.
Yeah.
So I've been seeing most of my patients online. While they're self-isolating at home, I can't visit them to reduce the infection risk. But even just taking this small step, for a lot of people all day, they're just sitting in front of the TV, the computer, they're just in bed, no exercise. Just doing this 5 times, 10 times, 15 times, building it up slowly, gradually, the circulation starts. And it's almost, I don't know if you saw the look on Abdullah's face when he was doing it. There was a little smile there. Now, I'm not sure if he was nervous, he was embarrassed, but it's okay because he was smiling.
Yeah.
And the good thing is you can do a pre and post measurement. You can become a scientist here and say, okay, at the moment, what's your mood? What's your energy level like? Yeah. out of 10, 0 for mood, 1 for energy, don't feel good. Then you get up and you do 15 star jumps and you sit down. Okay, so how are you feeling right now? And they'll be like, but I'm feeling more energized.
Yeah.
And again, this is another quick win, because, when we give advice to people, they don't always believe us. But when you give advice to someone and you practice it there and then,
Yeah.
and they feel that difference, they believe you. There's that yaqeen, that trust. Okay, yeah, this is working. I can do it. This is a step to start building on now.
Yeah. Even like, so we had the hardest part in this part, which is social anxiety, worry, and depression in general. Well, this topic, I know each part of it need hours, maybe sessions, but just in like general words, let's say in compromise time, how to deal with it.
So, like you said, this is a big step. I'm just going to put forward two quick suggestions. One is to do a gratitude or blessing journal. Yeah. So, with social anxiety, people often put themselves down. Yeah, they are worried that they're going to do something wrong. So the focus.
What is social anxiety? Can you
define? So the main definition of social anxiety is that the person has a fear of negative evaluation by other people.
Exactly. Yeah. And we face this problem in Iraq, especially. They see COVID as shame.
Right.
We face many of them, like they say, I have tifo, I have typhoid, I have like flu, it's normal flu, I don't have COVID. Just they have, and I talked with many of them. They said because of people run away from us, they want to come from. I said it is normally like you have infection, you have to isolate yourself. When you are cured, maybe some reaction is wrong, went in the wrong way. Some of them, they say, well, I want to visit a physician. He don't accept to host me. I said, yes, because you will share the infection. It's not because of problem with you, but you have the infection when you cure. So health, one of the things like indeed what we face now. Yeah, please.
Thank you very much for explaining that. That's I think that's really important and helpful. And I guess one of the other then techniques that we might use is to take the patient who's suffering with this and ask them to put themselves in someone else's shoes. So now imagine your friend has got these symptoms. If they told you that they had COVID, how would you judge them? Would you judge them as a person, or would you make a decision around their current condition, which is temporary, is transient? Today they have COVID. In 2 weeks, 4 weeks, they don't have COVID. The infections come and gone. It's not a permanent part of an individual's identity. So I think what you say about this fear of rejection as a person can be differentiated from a very normal and helpful isolation. If people are rejecting to come and see you for 2 weeks, that's good for you and it's good for them. And I guess you can challenge their longer term perception by getting them to switch roles. Would you do that? Would you avoid someone forever? Would you break ties with your best friend just because they've got COVID? So yeah, I think taking a different perspective, whether that's social anxiety, whether that's worry or depression, I think can be really helpful. Just going back to this habit of keeping a daily journal of your blessings or your strengths. This is based on the theory that when we're worried, when we're feeling anxious or depressed, when we're feeling really down, the focus is all on negativity. So in terms of the reality, there is negativity. So you can't tell people don't be negative, because you don't want to deny the reality. But reality has negative and positive. It has weakness and it has strengths. So if this person's scales is going, just a pure focus on the negativity, by introducing an ability to look at things in a more balanced way, by focusing just daily, just on your notes section in your phone, just on a piece of paper somewhere, writing down 5 things that are your strengths, 5 things that maybe you're just grateful for, your blessings. I'm going to put you on the spot here, Abdullah, again. You know, you must get used to this now. Can you help identify 5 of your blessings?
Being alive, being healthy, get the knowledge I have now, being able to help people, and helping orphan, which I find special for myself.
Yeah. So a really beautiful range of opportunities, of gifts that you have. And that doesn't deny all the challenges that you have, but it helps you to get some balance. And I think this can be a really powerful step on a daily basis to help counter or to try to manage the negative effect of anxiety and depression.
One of the things I want to mention here, that in many discussions with some of my colleagues, as you mentioned maybe twice or more about empathy, I say treat patients even when they are anxious or any problems for any reasons with empathy. They are in hard situation. Even some of them may be low educated for many reasons. He have bad temper, but deal with them as even family member or someone like this with empathy. They said, well, I believe I must be, or should be more professional, not showing sympathy. And he answered by that, sympathy is not important. Then I find that there is no relation between empathy and sympathy. So just maybe I brought this topic from external, but what can you just in a few minutes or seconds, even just to mention the as you mentioned many times.
So you might actually find different definitions in the dictionaries of different countries. But if I just talk about the principles, and hopefully we can focus on the principles rather than the words or the semantics of empathy and sympathy. When someone is in pain, we can recognize their pain, we can feel their pain, and we can become consumed by their pain. And then we become ineffective.
Exactly.
I'll give you an example. I'm in a battle with my friend, and it's me and my friend, and we're having a battle with some other people. There's some fight, and then my friend has been injured, and he's saying, my leg is hurting so much, I can't move my leg. So I'm saying, I can feel your pain. That feels so horrible. And actually now I'm becoming overwhelmed by the difficulty in my own way. And now we're both struggling. Yeah, I'm struggling so much. I'm so upset by his pain that I can't even help him. So some definitions of sympathy may talk about that over identification with someone else's pain. Yeah. Now, in terms of the principle, on the other hand, we could say, oh, there's your pain. That's too bad. Look, I'm okay. And we're not having any connection with what they're experiencing. And then there may be more of a middle ground where we can tell them, we can communicate to them that, I can recognize what you're feeling, and that what you're feeling, even though I recognize it, I can't say that I can feel it. Yeah, because I'm not you. I'm not going to pretend to be in your shoes. Yeah, I'm not in your situation. I can recognize it, and I can recognize that must be difficult. But that doesn't mean that I'm going to internalize your problem. The fact that I can recognize where you're coming from helps to build a bond, helps to build some strength in that relationship, builds the trust. Now, when that person feels that they can trust you, because you've made an attempt, even though you're not understanding exactly what they're feeling, you're recognizing what they're feeling. It gives you an opportunity to interact with them in a more sensitive way, and it gives them an opportunity to open their heart to you, to accept what you want to share with them. And I guess that would probably be more along the lines of this principle that I'm trying to communicate, this balanced idea in empathy.
Mm. So you mean here with empathy, I will look for their problems from their sides or aspect?
Yes.
Yeah, because many times as a physician, I see it is stupid that what they complain from. For example, I have many patients, they complain they have sore throat, while I'm worried that he have normal oxygenation, he don't like have the expected like thrombosis or any dangerous, but he come and complain a lot about this. Maybe from my aspect is nothing. From his aspect, like he can't sleep, like he suffer for the whole night, for example, from this pain, even it is not dangerous. Yeah. So,
yeah. And I think this is an important point, that when we want to demonstrate effective empathy, we don't have to agree with them.
Exactly.
We have to acknowledge them. And, if you want someone to change their perspective, even on themselves, by starting by disagreeing with them doesn't help to open themselves up to understand what you want to say, how you want to help them. If you really want to influence them, you have to be able to show them that you can understand and what they're feeling is okay based on what they're thinking at the moment.
Mm-hmm.
It softens the heart in that respect, and allows for a much more effective communication and relationship.
Well, the last point in this part, which is indeed is very dark, rising in Iraq, it is the risk assessment for suicide thoughts or suicide attempts. The problem, personally, I had 3 patients. They tried to commit suicide. Alhamdulillah, they didn't die. Like they tried indeed, and we tried them.
Unsuccessful.